Now, Robert, tough question for you. Do you look at your African markets as cost centers or profit centers?
Well, I mean, they do return some profit. Certainly, they are laggards in terms of the amount of profit returned to the company. But we just finished doing a major initiative, which I co-led in the company, around global access, to turn the view of developing country markets into a more of a commercial view, understanding that the people the neglected 4 billion people in the world, with respect to at least to medicines, for example, represent today a $30 billion market. In 10 years, it'll be a $60 billion market. Well, somebody is earning money from those markets. So we have set about to begin to figure out, all right, how do we increase our commercial return? And it will take a number of things for us to do, but I think that's an evolving effort at Pfizer, so it's definitely a commercial market. But even in philanthropy, and because one of the groups I manage at Pfizer is the philanthropy group and the foundation, I have resisted people, NGOs, governments, even people within the company, sort of ghettoizing philanthropy. We have made a tremendous amount of progress, as I said, in the world, in health and education, through philanthropic efforts, actually. And I have a really great story. I didn't tell you my favorite development story.
I think that it's tough to beat the fire.
No. This is a much better one. Pfizer signed up with the WHO, the Carter Center, the International Trachoma Initiative, and governments around the world where trachoma, which is a blinding disease, they used to keep you from coming in the United States if you had trachoma when you arrived at Ellis Island. It's a preventable disease, and it's the second leading cause of blindness in the world, first being cataracts. In Ethiopia, we set, along with our partners, very clear goals about our initiative, and there's a strategy around it. It's called SAFE. Surgery to try to reverse it, antibiotics, we provide the drug, face washing, and environmental change. And one of the components of environmental change is building new sanitation. And in one district in Ethiopia, we set a goal to build 10,000 latrines. Now this is where you set great goals and you let the local people sort of really execute. And you think you set a really grand goal, 10,000 latrines in a year. Well, something we didn't know. The Carter Center led the effort, teach them how to build latrines. We came back a year later and they had built 300,000 latrines. And we were just stumped. I mean, just how did this happen? What happened? And they were high quality latrines. Well, what we didn't know was in this part of the world, in this district, for as far back as anybody knows, women did not use the restroom during the day for a religious custom. Only men could evacuate themselves during the day. Women could not. They had to be covered. It had to be in private. So they only went out at night. Well, the women began to build the latrines because they could use the restroom during the middle of the day. Now that was a goal we set without, we set the goal, we thought, with the health ministry to build 10,000 latrines, with all the men in the health ministry. Well, when we went out to the district and started building latrines and people understood what they were used for, the women said, oh, the heck with this, we're not building 10,000, we're going to build a lot more, and they built 300,000 latrines. Now that's a development story. It's low tech, it's improved sanitation, and it's changed the quality of lives for women in that district.
You know what you're making me think about? Hello, is this on? Yeah. Is that maybe what we need to do is do a little bit of value chain mapping. In terms of, as we were talking about information, but also, okay, someone's building the latrines, and then this sanitation piece is going to work, and then we've got a surgery piece to this, and that we start trying to map out a more holistic approach to the different elements of, say, the hygiene path or the education path, and then create signals around it. Like you said, it was local bottom up, if you give the tools and everything, but you create some kind of a signaling so that it's kind of like a hybrid between kind of that Jeffrey Sachs idea of top-down thing, but and the William Easterly thing of bottom up. Let's try and figure out how do we get to some kind of synthesis on that.
Really nice about Robert's stories, I mean, perhaps to some extent accidentally, you really connected with something that local people cared about. And to a much bigger extent than you might have even envisaged before going in with your 10,000 latrine idea. Something similar happens to us in Asia, where we've been working on low-cost sustainable energy solutions for rural households. And the idea came up to construct small biogas plants in the backyard of rural households, where basically if you have 2 cows or 2 goats, you can turn human and animal waste into biogas. And that got spin-offs just beyond the energy spin-off, way beyond what we had ever imagined, because I mean the women no longer had to cut wood, so there was no longer smoke in the small houses where they lived. So there were health spin-offs, there were economic spin-offs. There's a whole contractual cottage industry that arose around all of this to build these things, to maintain them. I mean, we're doing this now. We've built and helped build over 200,000 of these installations across 5 countries, reaching almost 1.5 million people. I mean, nobody ever thought it would just excite people.
But that's why you need a clearinghouse. So
there you go again.
So that others. This guy's had a
Mary?
question.